So it's very unfortunate that such an obstetric emergency has happened to the patient, and my heartfelt feelings for the family. But emergencies like amniotic fluid embolism, pulmonary edema, pulmonary embolism, deep venous thrombosis are all known to occur in pregnancy. They are rare, I agree. And we as doctors and lifesavers do our best to help such a patient pull out of such complications. In spite of our best efforts as doctors and lifesavers, fatal complications are known to occur in mothers.
Heartbreaking to hear about the news that's happened in motherhood, but it's even sadder to know about the point of view of on a newspaper. And that's one of the things that doctors are talking about a lot these days, how media distracts and diverts information that's happening inside hospitals. Now, our plea as doctors is that although our hearts are with the mom and her family, we are also mothers, and our heartfelt plea is that listen to the right story, listen to both sides of the story, and then come to a conclusion. When I look at what's happened in the hospital, the first diagnosis that comes to my mind as an obstetrician is it could have been amniotic fluid embolism. It could have been, and the only thing that will actually confirm it is an autopsy. Having said that, amniotic fluid embolism is one of the rarest complications, and when it occurs out of the blue. It occurs in healthy women, and it almost causes an 80% mortality, which means that moms do die. It's very, very sad. We try our best to save these women. Doctors all over the world are doing their best to save these women, but in the best of the hands, in best of the hospitals, in the most advanced countries, moms are still dying, and we are as helpless as you. So please, 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 don't point fingers at us at these difficult times. How much ever you are grieving, we are grieving as well. So please understand our point of view.
I am Dr. Chitralekha, consultant obstetrician and gynecologist practicing in Bangalore. Amniotic fluid embolism is an extremely rare complication which I myself have not seen so far in my practice. But from what I know, it happens at the time of the labor when the amniotic fluid or the bag of water ruptures, and during that time, accidentally, the amniotic fluid leaks into the maternal blood circulation, which can reach into the mother's heart and the lung and causes a cascade of allergic reaction, which is so severe, so dramatic, so sudden. With all our help around, what I have heard is unable to save the mother. It's very unfortunate because it is so rapid and so traumatic even for us as doctors, that in front of our eyes we seeing this happening and we are unable to do anything to save the life of the mother. Thank you.
Amniotic fluid embolism is a very serious condition, and thankfully it is very rare. It usually occurs in term or near term pregnancies in labor just after the rupture of membranes or just after the delivery of the fetus. What happens here is that the amniotic fluid goes into the sinuses that are open, and this amniotic fluid and hair and the lanugo all get into the bloodstream of the mother and reaches the left side of the right side of the heart, and then because of an allergic reaction there is a decrease in the blood flow from the heart to the different parts of the body and lung especially. So, therefore, there is not enough of oxygen going through the lungs to the different parts of the body, and because of this a whole lot of reactions take place in the body, which ultimately results to death. If there is a proven case of amniotic fluid embolism, it is very difficult to save the patient. These are one emergencies we have not been able to tackle in spite of modern medicine. So, whenever there is an amniotic fluid embolism, it's a case where women mostly die rather than be saved. And I think that one should understand that doctors don't try to harm any woman nor a pregnant woman. Doctors are here to heal and are here to cure, and therefore such things are beyond our control. Thank you very much.